Hi, my name is Sandy Peralta and I'm going to talk about diaphragmatic hernia causing lung collapse. First we have this is a case. We have a 54-year-old man with a history of cerebral palsy and mental impairments present with acute respiratory distress. We had that he was afebrile and had a non-productive cough.
Congenital diaphragmatic hernia, or CDH, is a birth defect that allows abdominal organs to pass through the diaphragm, enter the chest, and inhibit lung growth. This can cause breathing problems after birth. Let's take a closer look at the hernia. The chest is separated from the abdomen by a thin muscle called the diaphragm. Sometimes very early in fetal development, the diaphragm fails to completely form. This can cause some of the organs in the abdomen, such as the small intestine, stomach, or liver, to move into the chest cavity. These organs press against the lungs, slowing down the lungs' development as the rest of the body continues to grow. This can cause two main complications: pulmonary hypoplasia and pulmonary hypertension. The severity of this condition requires a comprehensive approach. At the Colorado Fetal Care Center, our dedicated multidisciplinary team has...
Continuing. Now we have a chest radiograph showing near complete pacification of the right hemothorax, with gas-filled bowel loops and the right that extend to the level of the aortic arch. Panel A, a radiograph obtained approximately 3 months before the presentation, had shown a small right diaphragmatic hernia. Computed tomography of the chest performed during the current presentation confirmed the presence of the right anteromedial diaphragmatic hernia. Panel B, with a defect in the diagram that measured 4.5 centimeters in diameter. Now we have another video. Minimally invasive surgery for a congenital diaphragmatic hernia.
By placing the infant on his side, it's possible to gain access to the hernia located in the diaphragm. The surgeon creates 3 small openings, called ports, to allow a tiny camera and instruments to enter the chest. The camera offers a magnified view of the area. The surgeon pushes the abdominal contents located inside the chest back through the hernia and into the abdomen. This allows the medical team to view and inspect the underdeveloped lung. Over time, this lung will grow to fill the chest cavity. Next, the surgeon identifies the edges of the diaphragm and sews them together so that the abdominal contents cannot move back into the chest. If the defect is large, a patch is frequently used to close the hole. Finally, the surgeon removes the instruments and ports and closes the tiny port incisions.
Okay, next one. We have the right lung was completely collapsed with the mucous plugging of the right Manstein branches arrows. There was only a mild mediastinal shift of the left, and finding that was consistent with a high degree of lung collapse accompanied the hernia and that was probably related to proximal bronchial obstruction. Visible within the right hemithorax was a large volume of abdominal bowel contents, panels C, D, and E, including the majority of the right colon, the appendix, multiple loops of a small bowel, mesenteric bags, and almond turn. We have now another video of the treatment of pneumothorax, or when a lung is collapsed. When a pneumothorax is diagnosed and is expanding, the pressure must be relieved or the lung collapse will worsen. As lung collapse worsened, oxygen transfer to the bloodstream worsened. The red part is oxygenated blood and the blue part was desoxygenated. Decreased oxygen delivery. We have the blood cells and oxygen with green, oxygen blood cells, the red ones. A pneumothorax can be treated with the placement of a chest tube. We have the chest tube right there. We'll be introducing into the lungs. The chest tubes allowed re-expansion of the lung, resulting in improved oxygen transfer. We have now the improved oxygen transfer right there. And now the oxygen is obviously now in all the red cells. Okay, continuing. Now we have physical examination revealed the use of accessory muscles of ventilation, decreased right hemithorax expansion, and absence of breath sounds in the right hemithorax with audibly vowel sounds. The patient had mild hypoxia. We have the last video. That will be the surgery of the hernia. Okay, continuing. Now, the conclusion, because of the location of the diaphragmatic defect, the hernia was most likely a Morgagni hernia. These hernias are usually congenital in origin and can increase in size over time, as in this case. In accordance with the wishes of the patient and his family, no surgical repair was attempted. Now we have the last video.
During normal respiration, the lungs expand and contract within the chest cavity. The lungs are encased by 2 layers of tissue, similar to a fist that has been pushed into a balloon. The space between the layers, called the pleural cavity, is lubricated so that the lungs can slide comfortably across the chest wall. If air enters this space, it is referred to as a pneumothorax. One type of pneumothorax, called a traumatic pneumothorax, can be caused by an injury to the chest. A blunt or penetrating chest injury can cause a small tear on the surface of the lung, allowing air to enter the pleural cavity and to become trapped. The pocket of air produces excessive pressure on the lung, causing it to collapse.
Okay, thanks for watching. And have a nice day. Bye.